Hello, everyone. Welcome to the Carroll County NAACP COVID-19 Conversations. This event is hosted by the Carroll County NAACP Health Committee. We would like to thank you for tuning in and getting educated about the vaccine from healthcare professionals and Gen Y and Zers. I would like to introduce you to our two co-moderators for the night, Dr. Thelma Lucas and Dr. Charlie Rouse.
Good evening. My name is Dr. Charlie Rouse, and I'm a local cardiologist, practicing adult cardiologist here in Carrollton, Georgia. We are absolutely delighted that you have joined us tonight. We are here to discuss and answer your questions centered around COVID-19 vaccines. As you're aware, there are three vaccines that are available here in the United States, Pfizer, Moderna, and J&J. And if you have any questions that we don't get to, we will be sure to connect with you through the social media platform of the NAACP later on. Before I introduce our co-hosts, let us establish just a few ground rules, if you will. One, you will not be able to vocally interact with us. So if you have a question, please go to the chat box and place your question there and we'll get to it. And again, if we don't get to it immediately, we'll try to connect with you through the NAACP's social platforms. Two, at the end of the program, if you have any suggestions, any thoughts, concerns, likes, please go put them in the chat box as well. This will help us with future programming. And thirdly, if you're not talking, please place your device on mute. And now let me introduce you to our co-moderator, Dr. Thelma Lucas, after which you will hear from our esteemed physician panel. Each one of them will introduce themselves. These are physicians that take care of you on a daily basis. Following our physicians, we'll have a very important, very special guest representatives. And these are from our Gen Z and Gen Y generations. This is our younger generations. This is our future. Dr. Lucas.
Good evening, everyone. Thank you for joining us. So here we are. It is 2021, and we are still in the midst of the COVID-19 pandemic. And a lot of things have happened. There's been a lot of advances as far as medications that we have to treat this virus. And while the number of cases of COVID-19 are going down, we still have a lot of disease, a lot of infection out there. And so it's important that we not take our foot off the gas right now. So we have to keep pressing forward. And we want to have just a very lively discussion with you tonight and answer any questions that we can about the vaccine. And if there's anything that we can do to get you off the fence and get a vaccine in your arm, that's what we are here to do. So at this point, we'll have the panelists introduce themselves. They'll tell you a little bit about themselves, what their specialty is. We'll start with Dr. Floyd.
Yes, my name is Dr. Gregory Floyd. I'm a family physician in Carrollton, Georgia. I'm in private practice. I practice full service family medicine, which means I take care of patients in the hospital as well as in the office, and I take care of not only children, but adults. So I've had quite a bit of experience across the board, both in the hospital and in the office, from young people to older people as it pertains to the COVID-19 pandemic.
Thank you. Dr. Jerome.
Hi, my name is Dr. Jerome. I'm an anesthesiologist. I'm the person that you see when you need to have surgery or your baby, or sometimes if you're in the intensive care unit. I practice at Tanner Medical Center, all three locations, Carrollton, Villa Rica, and Bremen.
Dr. Grillo.
My name is Megan Grillo. I'm an obstetrician and gynecologist. I also practice here in Carrollton, Georgia, and over the last 15 months have taken care of many pregnant women who are dealing with COVID-19 infection, and we'll be happy to answer any questions you have about reproduction as it relates to COVID-19.
Dr. Pham?
Hello, my name is Angela Pham. I'm a rheumatologist practicing with Tanner Rheumatology Specialists in Carrollton. My specialty is special types of arthritis where the immune system is overactive and attacking your joints and your body. COVID-19 has been very special in my specialty, and I'm here to help relay any anxieties in regards to the vaccine, the infection, and what and how has it affected autoimmune diseases to date.
Thank you. Dr. Laura Larson.
Hi, I'm Dr. Laura Larson. I am an infectious diseases physician. I've been at Tanner now almost 16 years, and I'm from Carrollton, so this is home for me. I'm the medical director of infection prevention at Tanner Healthcare System, and I'm also the chairman of the Carroll County Board of Health. And I hope to answer any questions anybody might have to allay fears about getting vaccinated.
All right, so now we'd like our young people to give us your name, and you can say a little bit about yourselves if you like. We're going to start with you, Sebastian.
Hello, everybody. My name is Sebastian Mason II. And I think I was called to the board just because of, I think I've taken a lot of representative responsibilities in my community, and I've been through a lot of conversations about the virus, and I've heard a lot of questions from my peers, and I think I'm in attempts to propose some of those today and get some answers and see, the effects of the vaccine, the effects of the virus, and hopefully ease some minds as I carry that information into my peers in my conversation. So I appreciate y'all for letting me tag along today.
Thank you. Elise Larson.
Hello, my name is Elise Larson. I'm a senior at Bremen High School, and my mother is Dr. Laura Larson. So I've had a very precarious position during this pandemic where I've gotten to see a lot of the insight that my peers don't really get to see. And so I hope that by speaking tonight, I can relay a little bit of my experience in this insight that I have with my mother.
Thank you. Kaylin Thomas.
Hi, my name is Kaylin Thomas. I'm going into my second year at North Carolina A&T, and basically I can just give the college perspective on how students are feeling about the vaccine.
Thank you. Jerinez.
Hello, everybody. Thank you for having me in the panel. I am not in college. I'm 29, so I'm out living, working. So I definitely have people that are concerned in my age group. So being here, I could kind of voice their concerns and kind of get all the information so I could give them to them, because there is a lot of misinformation out there. So I kind of want to clear it out with stats, especially having actual doctors that could help out and give that information. So thank you guys again for considering me to be here. So.
Okay. Thank you guys so much. And again, we want to give a special thanks to our young people. We really value your input, and thank you for coming on. Dr. Rouse, turn it back to you.
Yes, so our first question goes to you, Dr. Larson. Can you give us an update on where we are as a nation, a state, and perhaps even the county as it pertains to vaccination?
Sure. So I pulled these numbers today, so they're accurate as of yesterday when they were turned in. In the United States, 48% of our population has received one dose of COVID vaccination, and 38% of United States citizens are fully vaccinated. So that's 48 for one dose, 38% for fully vaccinated. For Georgia, that number's lower. 37% of Georgians have received one dose of vaccine, and 30% are fully vaccinated. So roughly about 10% less of each than the United States itself. For Carroll County, unfortunately, it's even worse. Only 23% of our population has received one dose, and only 18% of Carroll County residents are fully vaccinated. So I feel like it's really important that this information get out, because we are certainly behind the rest of Georgia, and we are behind the United States as well. So those are the numbers.
Dr.
All right, so we're gonna just jump right into some of the questions. And again, if those of you who are joining us live have questions, you'll put them in the chat box and we will try to get to those as well. So we'll start out with just asking, what are the symptoms of COVID? And if I could get just a couple of the docs to answer each question. So what are the symptoms of COVID-19?
Well, this is Dr. Floyd. The symptoms for COVID-19, from my experience, and what's been put out by the CDC, and we've seen on the news, they vary widely. It could be anything from a sore throat to a cough to increasing shortness of breath for someone who's never had shortness of breath before. Fever is a common symptom. People have the other symptoms of sometimes loss of sense of taste or smell. And the challenging thing for COVID-19 virus is that these same symptoms sometimes occur with other illnesses that we've already experienced. Sometimes it could happen with the flu, body aches, general muscle aches, generalized fatigue and weakness. A lot of these things we can see sometimes in pneumonia or even the common cold. So it's sometimes difficult to kind of discern, like, do I have a cold or do I have COVID? But the symptoms vary. Some people have no symptoms. Some people are completely asymptomatic, meaning they feel perfectly fine, but they actually are infected. And that has been the greatest challenge with this disease, I feel, is that those people don't even know to take certain precautions. That's why we had the mandates for masks and everyone to wear masks, because sometimes you don't even know when you're infected. And the last thing you want to do is infect someone unknowingly. But this is something that, we've dealt with for actually centuries in terms of infectious disease. But, it's been a long time since we've had something to affect the world worldwide to where it is brings us to where we are now. So, the symptoms vary widely, and I think this is an issue with some of us hearing what we hear about what's happening with the disease, and then looking at themselves saying, well, I had it and I didn't have any symptoms. I felt fine. I did fine. So why should I get a vaccination? Or why should I wear a mask? Because I'm fine. But infectious disease is not political. It is not something that you can go on the internet and listen to what your friends say on Facebook. It's something that you really need to listen to the scientists, listen to the doctors, listen for the Centers for Disease Control to give you guidance on what to do and how to proceed.
Great, thank you. Dr. Rouse?
So, Dr. Jerome, if I had COVID, when can I get the vaccine?
So my understanding is if you've had COVID, I know the guidelines have changed significantly. If you've had severe COVID where you required hospitalization, perhaps more on the ventilator, received some of those COVID medications, plasma, remdesivir, a lot of fancy named drugs, then you should wait 90 days. I believe now, if you've had a mild case of COVID, which is one that did not require hospitalization, supplemental oxygen, and you did not receive any of those meds, you can now get the vaccine within 20 days of being asymptomatic. So run. because you can get it again.
Thank you. Dr. Lucas?
So, what are some of the barriers to people getting the vaccine? Let's see, Dr. Grillo.
Well, as the OBGYN in the chat room here, the most common barrier I hear is concerns about fertility and reproduction. We'll get into that question in a little bit. I also think access is an issue, unfortunately, that people may not understand how to get signed up and registered for the vaccine. And then, unfortunately, there is just so much misinformation. Like it or not, this entire virus has become a political issue, and it seems to matter who you vote for, how you choose to address this pandemic. As a medical professional, I certainly don't see it that way. This is a medical problem, not a political problem that we're facing right now with this pandemic. But I do think that that is commonly the case as well, that we've become polarized in terms of how we're addressing this and whether or not we choose to believe the science. Some people, unfortunately, are choosing to believe hearsay and rumors and frankly, made up information rather than choosing to believe the science.
Thank you. Dr. Pham, anything to add to that? What are some of the barriers that you are hearing?
In my patient population, it's mostly revolving around what type of side effects will I have? Will it flare my autoimmune disease? Will it make me have COVID? Will it make my medications less effective? Or if I have to get the vaccine and I hold my medication, will I flare? And a lot come to me because they're afraid of the unknown, and there's so much science behind it, and we're so used to there being years and years of research, and all of a sudden a magic vaccine appears, and there's a lot of suspicion and going around, just floating around that. Another big fear is, what are the long-term side effects? And not just in autoimmune diseases, but just for the general population. What will happen 3 months, 3 years, 3 decades down the road? I find that the most challenging thing to counsel about. But mostly in my population is just fear of the unknown and what will happen to my body, because my immune system is already so hyperreactive and in a disarray. Why would I introduce something to my body that they feel we don't understand, that could potentially worsen my symptoms? And it's been challenging, but fortunately with my patient population, the ones that have received it have done very well. And so that's nice and reassuring.
Good to hear. Dr. Ross.
So I want to bring in some of our Gen Z and Gen Y individuals, actually all 4 of you, Bill. Why did you decide to take the vaccine? We'll start with you, Sebastian, and then Elise, Kaylin, and then Jorinnes.
Yes, sir. I was incentivized by the college that I'm planning to attend in August. Morehouse required me to get the vaccine, but I did have intentions prior to this, simply because I know that it's advantageous to have that extra shield of protection. And I was eager to get past the phase where we have to wear a mask in public, where we have to social distance. And from what I've researched, the vaccine, if a large amount of percentage of the population gets it, then we can soon approach that status where we can discontinue the mask and discontinue the precautions that we're taking.
Elise?
Well, my reasons for giving the vaccine, I suppose there are 2 of them. The first one is, the kind of public duty that comes with, protecting yourself in order to protect others. That was the main reason. But, on a much more personal level, I'm sure we can all agree that, especially my age group, the main incentive for getting the vaccine is hopefully returning, back to normal at some point.
Thank you. Ellen?
Well, at first I was hesitant to get the vaccine because one of my friends had got her second dose and she was really sick that day. She couldn't get out of bed. But I saw my aunt had got the Pfizer vaccine and she was fine. So I went ahead and got it. And plus, my school's going to require it in the fall, and a lot of events are requiring you have proof of vaccination to attend them.
Jonas?
So my fiance and I actually talked about it multiple times. We were kind of hesitant at first because of the misinformation. But one of our main reasons is because we have two young girls and we have a lot of family members that are high risk. Their health is not the best. So our thing was like prevention, if we could prevent it. And he works with the general public. So he's, things are starting to, I guess, go back to normal and whatever the new normal is. So that was our main reason, prevention. We have kids and close family that we want to be able to be around without worrying about their health or them getting COVID. So, yeah.
Thank you. Dr. Lucas?
Yeah, so to the panel, is it really necessary for the young people to get the vaccine? We know with older patients, they have a lot of health issues. They're certainly at risk of getting very sick and dying from COVID. But is it really necessary for, let's say, people under age 35 to get the vaccine? I mean, they're out and about, they're living their lives, they're doing what they do.
That's one of the groups right now, the younger people where we're seeing highest rates of transmission. So I think it's really important for young adults and adolescents and to get vaccinated. The main reason we get vaccinated is to stop the spread. We were having a conversation last night with some other infectious diseases physicians about should people under the age of 12 get vaccinated because they almost never get sick. Now, we've had some die, but the big thing we always forget about, and my argument to people that say, well, there's a 99% chance I'm not going to die, is that in the age group of under 12, there have been 1,500 children that have gotten MIS-C, which is the multi-inflammatory syndrome of children, MIS-C. And these kids are sick and often in the intensive care unit. And I would never want anything to happen to my child for that. And so we're also seeing that syndrome in adults as well. And then the final thing I would say is, even though there is about a 99% survival rate from COVID, there's a 20% chance you'll be hospitalized. There's a 5% chance you'll go in the ICU. And we don't really know why, but there are some long-term effects from it. My medical assistant in my office had COVID in December. She still cannot taste food. And in fact, it tastes bad. So she has lost 30 pounds and didn't have 30 pounds to lose. And the only thing that tastes good to her is vanilla ice cream. And that is all she's eaten now for about 6 months. And it's not come back. So yes, there's a good chance that you will survive, but there is a good chance you will survive with something that alters your life forever.
Dr. Floyd?
Yeah, so I wholeheartedly agree that young people, one of the things that I do every day is I deal with all age groups. And in dealing with all age groups and being not that far removed from being a young person, don't let the gray fool you. Is that when being young, you feel invincible. You feel like you can do anything. You feel like you can go anywhere. But young people are the most likely to deal with large groups on a regular basis. You know, because we are just getting to know ourselves as a young person. I remember being a young person and getting to, you know, just learn things. And you constantly want to be around your peers. In doing so, you are at much greater risk. And yes, you are less likely to become sick enough to become hospitalized or require oxygen or require medication. But at the same time, you become a significant risk for your family. You become a significant risk for those elders who you hold so dear in your family. And you want to be able to interact with them. You want to be able to learn from them continually. You want to continue to be around them. And as a young person, we kind of sometimes take those things for granted when you're young. You don't necessarily remember all the things grandma showed you and grandma taught you until you get a little bit older and you realize that, wow, that was profound for me. That changed my life. Or an aunt or an uncle. Or so this is why it's so important for our young people to get vaccinated to stop the spread of the disease. I mean, it is an infectious disease, and even if it does not affect you in a manner where you feel horrible or you have the bad symptoms. But there are things out there that can happen even in a young person. I saw a patient today who is under the age of 35 who still has not had her taste or smell truly return. That's significant. I mean, that's significant. So, this is why, as a young people, I know how they think, for the most part. But I understand that, they're like, why should I have to do this or why do I need to do this? Well, it's the same reason why we've done things in the past, everything from smallpox to chickenpox to measles, mumps, and rubella. All these things that you don't really hear about anymore. Why don't you hear about anymore? Because you got vaccinated. And everybody else, for the most part, got vaccinated. Some of the most, I guess, unnamed heroes of the world are in the field of public health and work for the CDC because they actually prevent the things that used to be pandemics, used to be epidemic. So, you never hear about them because nobody talks about it anymore because you don't get it. This is why vaccination is so important, not just with COVID, but with pneumonia vaccinations, with influenza, meningitis vaccinations, um, HPV vaccination. All these things are very important in terms of keeping yourself healthy, safe, as well as the people around you.
Thank you, Dr. Rouse.
I'd like to ask each one of the panelists to answer this question, including the Gen Y, Gen Z, very, very briefly, if you will. How did you feel after taking the vaccine? I'll start with you, Dr. Larson.
Utter relief. My husband's best friend in medical school died of COVID, and not a single day went to work that I went to work, that he went to work, that I think that I could get sick. And so it was incredible relief and elation.
So I'm talking both physically and mentally, Dr. Grillia.
Mhm. I definitely would reiterate the relief as well. In terms of physical symptoms, so as I said, I deliver babies for a living. So when I'm working, I'm often working all night long. So in both cases, when I got my vaccine, I worked the entire night afterwards. So the next day I was pretty tired. I had a little bit of a headache and felt a little bit achy, but I can't even say it was worse than what it normally is after a 24-hour shift of work. That was really the worst of it for me. And that was far outweighed by the relief and the knowing that I no longer was, or I at least was on the path of no longer being a risk to my loved ones and to my patients every day.
Dr. Floyd.
I did actually very well with the vaccine. I really had no physical symptoms except for soreness in the arm. And it lasted for about a week or so. I had the soreness, but by the time I got the second shot, I had the Pfizer injection. I had no side effects, no issues. My entire family also had the Pfizer vaccination. And I think only my sister had a day of feeling not well the next day, but within just under 24 hours, she was completely back to normal and felt fine. So, it was great. And like Dr. Larson, it was a great relief to me to be able to be vaccinated, to feel like I have another layer of protection, because I also lost a colleague from medical school just a year older than me, who used to take care of patients in the nursing home. So, you know, it was just something that I was looking forward to, and willing to take.
I believe Dr. Coelho has joined us. Is that correct? Okay, if not, Dr. Lucas.
So I received the Pfizer vaccine and I got it sort of in the evening. And I felt fine that first day. But the next day I had a really severe headache, and my arm just started, I was working that day and was scoping, my arm just started getting sore and achy. So eventually I took some Tylenol and felt a little better, but I felt pretty crappy for the whole day. When I got my second shot, I took Tylenol immediately after my shot. And the next day I had just a very mild headache and a very mild arm soreness. So I did much better after the second shot than I did with the first. And again, just a sense of relief. And I was just holding my breath until some of my older siblings were able to get their vaccination. I was just so worried and so relieved when they were actually able to get vaccinated as well.
Dr. Jerome, both physically and mentally.
So physically, I had no symptoms with either shot, but mentally, my job changed tremendously in that I went to the ICU almost every day that I worked, and I intubated someone with COVID. I put a breathing tube in someone with COVID. And as I intubated them, I thought, I'm next. And I dreaded coming to a job that I love because my role changed. And the vaccine allowed me to kind of breathe again, because my big fear was that I was going to get it and that I was going to bring it home to my family, because we made a decision to still stay together in the middle of the pandemic. So while folks were at home tired of being inside of the house, I actually felt like I held my family hostage, because they saw the agony and they decided to stay with me. So the vaccine allowed me to love on my family again. And it allowed me to, once things slowed down, actually see my parents again after a year in 2 months. Because again, my fear was that I would give COVID to them. And the vaccine, if you follow the science, watch the right news station and Google a couple of articles, you'll see that it works. So a sigh of relief is an understatement for me.
Dr. Pham.
I felt so free and I felt so privileged to have been one of the physicians who was available to get the vaccine. And I remember when they announced it on day one, I was just itching to get there, itching to get there. And then I was one of the last people there. And we took a picture, posted on social media, and I just felt awesome. The next day, my arm hurt. And it hurt bad. But honestly, I've had multiple flu vaccines in the past that have hurt the most. Actually, the yellow fever really knocked me down. And so the second vaccine, I anticipated the same, and that hurt. And I should have switched my other arm, now that I think about it, to kind of share the pain. But that really only lasted about 48 hours. I had a bit of a headache and I had some leg fatigue. ultimately did okay. My nurse practitioner, she had a little bit protracted symptoms as well with low-grade fever. But both of us, we both were just biting at the bit to get the vaccine. So fortunately, she was able to tag along with me, and we both received it on the same day. So we felt like we needed a medal, and we wanted to walk around with it in the clinic. And a reason why I felt so free was my concern is I'm always examining my patients, and I'm in their face all the time because I have to touch them. I have to listen to their lungs and their hearts, and I'm always feeling on their joints. And my fear was not necessarily contracting the virus myself, although that's always a fear, but what if I was asymptomatic and I was passing it on to a patient who is high risk? That would break my heart if I found out it was partially my fault and I didn't do everything that I could to prevent that. And so I felt prevention is key. And once I got the vaccine, I felt more like myself interacting with my patients again.
Thank you. Ms. Larson?
Well, after I received my second shot, that was the shot that I had a little bit more of a difficult time with, but my symptoms really only lasted about a day after I received the shot. I just sort of felt just a little bit icky, and it quickly resolved. In general, I felt a little bit of fatigue afterwards, but that very well could have just been from being a senior in high school, not necessarily the vaccine. But mentally, I remember I can be a little dramatic sometimes. So I was expecting a pity party from my parents when I got home because, oh, we were feeling so, under the weather. But no, both of my parents were treating it as a celebration. It's a great thing. And it shifting my perspective like that really, I was able to look on the positives of getting the vaccine way more than getting bogged down and, getting a headache or something like that. So.
Thank you. Ms. Thomas?
I actually just got my first dose last week. And honestly, there wasn't really a lot of pain. I just had a sore arm for just that day. And the next day, everything was gone. I was fine.
Mr. Mason?
I've also only received my first dose. I'm scheduled for my second one, I think in mid-June. But physically it wasn't much to that first dose. My arm was a little sore, but mentally I think I did start to feel the relief, the excitement of approaching normalcy again after, like I said, a big population after we all get the vaccine.
Ms. Rossetti?
So I just got my first dose last week. I get my second shot next month. I did have like a sore arm and I did develop like a headache and I took a nap. It was a good nap too. But the soreness kind of lasted for a couple of days. My fiance actually didn't have anything. He was fine. I kept asking him, do you have a sore arm? Does your head hurt? Anything hurt? He said no, he was fine. So, but mentally, it kind of felt like a relief because I was hesitant at first. Like Dr. Pham said, like a lot of people are concerned with the unknown. So that was my concern at first, but it just felt like a relief. Like now, like we could probably bring some type of normal back to our lives and be with our families like we did before COVID hit.
Dr. Lucas?
Yeah, so I have a question. Is it true there's a microchip in the vaccine? Dr. Larson?
There's no microchip in the vaccine. A lot of people ask what's in it. So what's in it, and the Pfizer and the Moderna are both the mRNA vaccines. So there's a little piece of RNA. And then there is fats or lipids which surround that, and then salts and sugar to stabilize the vaccine. The sugar is actually so it freezes well and stays stable. For the Johnson & Johnson vaccine, that has the same salts, acids, has a little bit of alcohol in it, but to keep it sterile, but it's a virus that actually contains the blueprint for the spike protein. So no microchips, just components to teach your cells to make the spike protein antibody.
Has anybody else heard that? And actually, just recently, they said there was some company that came out and they were able to make the tiniest microchip in the world. And I'm like, not now, no, please. But okay, thank you for that answer, Dr. Rouse.
So we have a couple of questions that are coming through in the chat box. Dr. Jerome, Dr. Willio. It says, given the small number of persons in the county who have been vaccinated, am I right in assuming we should be wearing masks and social distancing into the indefinite future, even if we were vaccinated? Dr. Jerome?
We should still wear a mask based on the numbers that Dr. Larson gave us. My understanding, herd immunity, just by definition, is 70 to 80% of the population getting the vaccine and being fully vaccinated. One shot's better than none. Two shots, obviously, are what the science tells us that we need, with Pfizer to be about 90% effective. So you still need to wear your mask unless you hang out with folks that are fully vaccinated, meaning they've received both of their shots. And you still need to be responsible, is what I would say. Use your common sense. COVID doesn't discriminate. It doesn't care what you believe or what you feel. We still have to all follow the science. And yes, I would say you still need to wear your mask.
Dr. Grillo, your perspective on masks?
So I would reiterate what Dr. Jerome has to say. The only thing that I would just clarify, y'all probably know this, is that you're not considered fully vaccinated until 2 weeks after vaccination. So like with my 12-year-old who got vaccinated for the first time on Wednesday, he was pretty sure when he went to school on Thursday that he did not need to wear that mask. And unfortunately, mama had to tell him otherwise. But the recommendation now is that if you are in a group of fully vaccinated individuals, meaning 2 weeks after your last shot, you don't have to wear masks anymore. But unfortunately, in our community, so few people have been vaccinated that when you're in the general public, I would absolutely still recommend wearing a mask. And along with hand washing and social distancing as possible, the same recommendations that the CDC has been putting out since the pandemic began.
Sorry, Dr. Lucas?
Yes. So I mentioned that I felt a sense of relief when some of my siblings were able to get vaccinated. I'm sort of at the end, so most of my siblings are older. But not all of my siblings have gotten vaccinated. I hope you're listening tonight. They've not all gotten vaccinated, for different reasons. So a question that has come through the chat is, how do you talk to your friends and family who don't see the benefit of getting vaccinated? How do you do that? I mean, do you try to go with them, go at them with science, or do you just leave them alone? What do we do? And I need some help on this too, because like I said, I have some family members that are not yet convinced to get the vaccine.
Thelma, for me, I always try to find out, why. What is the main reason that you don't want to get the vaccine? For so many people, it's the speed at which it was developed, but people don't understand the main thing about it, the trials, and why they got results so fast. And I think we all know this here, but a lot of people don't know that a big clinical trial prior to this COVID vaccine time was 1,000 people. So we would study, let's say, people with flu, 1,000 people. That's a big study. So it may take months to years to get the results because you have 1,000 people you're studying and waiting for them to get sick. With the COVID vaccine trials, we had almost 100,000 people enrolled in the different trials. So what would have normally taken years of data took months to get, because they had to look for a certain amount of people to get sick that didn't get vaccinated versus people that got vaccinated. And they were able to, within months, get those results. And a lot of people don't know that. We studied way more people than we normally do. And we had to. We had a world in crisis with an infection. And the big thing I want to have happen is enough people get vaccinated so we don't see strange mutants come out that do something completely different and start to kill younger people.
I would say the other piece of that too is the government stepped in. So in clinical trials, these private companies, they use their own funds, right, to develop their vaccine. So it's a lot of trial and error. In this case, the government said, hey, we're in the middle of a pandemic. The only way out is a vaccine. The only way out is to study the science and figure out how we can conquer this disease so that the millions of people don't continue to be affected. So the government said, hey, Merck, hey, Pfizer, hey, whatever, here's X amount of dollars to stop what you were doing and put all of your best scientists on creating this vaccine. And messenger RNA isn't new technology. It's just, it was required for this. So those scientists continued the research. One or two were able to stabilize it, and then you see the fruition, the fruits of that labor. So it was a true collaborative, concerted effort that went into creating the vaccine.
So, and on that note, I'd like to ask our young panel too, because again, a lot of the older people have gotten vaccinated. So now it's, you know, it's your turn, the younger people. So how do you convince your friends that they should get vaccinated? Sebastian.
Again, as we've been saying, I think a huge incentive of the young population is to get back to normalcy. So after we eliminate the the reasons why somebody my age would be against the vaccine, after we eliminate those things, we approach that I take is that I convince through trying to get back to normal, because a lot of my peers they miss the concerts, they miss the gatherings, the parties, the socials, and you have to explain to them that the only way to get back to that safely, if you don't want to wear a mask and if you don't want to compromise anything, is for us to get vaccinated.
All right, thank you. All right.
You're on mute.
Sorry. Did any of the other our youth panel want to comment on that? What can we do to convince people in your age group? Yes, Elise.
So at least from the perspective of a high schooler, I find that especially with the very younger side of people that I'm around, parental influence is extremely influential. Especially for my peers who still live under our parents' roofs. Our parents' word is law, and so what I find is even some of my closest friends want to get the vaccine and understand themselves the benefits of getting the vaccine, but are quite literally not allowed to because of their parent. And other people may believe their parents' influence on the vaccine, and I believe that the most important thing I think is reaching the parents and having them understand, because that influence is so powerful onto their children. And some younger children really might not have a choice because it's their parents' choice to make at that age.
Thank you. Thanks, Dr. Rouse.
Along that same line, I'd like to ask the other two Gen Z, Gen Y individuals. I mean, what are you hearing? Why are people in your group hesitant to get the vaccine? So, Kaylin?
I think the biggest thing is that they already don't kind of wear their masks, or social distance. So it's not a huge deal for them to get the vaccine because they already feel that normalcy. In college, there's still a lot of parties and stuff. People are still going to party and have kickbacks. So they're still going to do that. So I guess they have no incentive to get the vaccine because they're already doing what they want to do.
Joannis?
So in my age group, it's mainly talking about how rushed it feels, the vaccine. Like, I guess their concern is of the unknown. What can it do to my body? Like, is there enough studies? Can somebody die from it? Can it cause other illnesses that I don't have? So that's one of the main concerns. And I know the conversations I had, they brought up the fact that, is it fully FDA approved? Like, it's just a vaccine that they just created and now they're like pushing it on us. That's one of the biggest, I guess, things that they mention. Like, they feel like it's just being pushed, something that's just been rushed and political as well. In my age group, we talk a lot about politics, and they made it all political and less medicine.
So can we have one of the panelists address her concerns? Has it been politicized?
No, from our perspective in medicine, it has not. And if you look at the number of physicians in our hospital actually receive the vaccine is extremely high, almost 90%. And that's a lot for over 200 medical staff, almost 300 to believe the science and not have more of a divide in that. The companies, there are multiple companies, not just the three that have made it in our country. There are multiple other countries. You have to remember too that there's still sort of, it's a competitive world, but for all of these companies to be making something to meet the same end of reducing illness is huge. Things were shared that normally were not shared among companies competing to bring something to market. So I hear what people say about feeling rushed, but I think if you understand just how many people were involved and went through, how many people were studied, that's the biggest thing. Politically, it's hard because, I think anybody would have been in a tough position having to deal with a pandemic anywhere in the world. And certainly we have a very political environment right now. I think that just, it feels that way because it's been on the tail end of a very politicized country right now. And on top of that.
So thank you for that. Dr. Coelho has joined us. And if you don't mind, Dr. Coelho, tell us what are you hearing, why people are vaccine hesitant, and what can we do about it?
So most of for example, my community, the patients that have refused to vaccinate are mainly from the Bremen, Villarica area. Most of the vaccinated ones are in Carrollton. Their main concern is fertility, especially in the younger community. And then the older community, they're concerned for allergic reactions, adverse reactions like anaphylaxis, or if some of their medications, like the lupus patients, they're concerned that the medications that they're receiving are not going to be as effective if they get the vaccine. So those are the main concerns. Yeah.
Thank you. Dr. Lucas?
So I'm just going to throw this out there. Is the Johnson & Johnson vaccine safe? So we had it. We were very excited. There were people that were waiting that said they weren't going to get the Pfizer or the Moderna because they wanted to get the J&J because it was only one shot. And then we started hearing reports here and there, and then it got pulled for a little bit. Is the J&J vaccine safe?
So they knew that they did see in the clinical trials that they were seeing some clotting events. And when it was released, there weren't enough people that had the events compared to the group that didn't have the events to know that it might be something that it was definitely caused by the vaccine. when we gave enough, millions of doses of the J&J vaccine, they had 6 reported cases of women under the age of 50 that had a major clotting event. And certainly there's probably more than those 6, but those were the 6 that the CDC halted the giving the vaccine, and they looked at those patients and they studied, what is there something special about them? And what they determined was the only thing that linked those patients is they were women under 50. So there is caution now about giving that particular vaccine to women under 50, but those same cautions do not exist for the Moderna and the Pfizer. And again, we're talking about extremely low numbers over millions of vaccines given. Like we know there were 6 cases that were reported that caused the halt. So it's one of those situations that I think it's an abundance of precaution to put out there that if you're a woman under 50, you may want to consider one of the other vaccines. So that's where we are. I still think it's an extremely safe vaccine. And I always tell people getting a vaccine and having a side effect is much less likely than having COVID and having a side effect.
Dr. Grillo, with that in mind, the women under 50, do you think that that this is because a lot of these women are already on birth control pills, or do you think that has anything to do with the cases that have been reported?
Unfortunately, we don't have any data on that to support that. It certainly could be due to hormone status of these women, their own innate hormone status, or maybe they were taking hormonal medications in the form of birth control for sure. Possibly. Unfortunately, historically in the United States, one of the shortcomings of research does have to do with the impact of medications when it comes to menstrual cycles, for example, and hormonal effects. So that data is actually being evaluated and looked at now, but currently there is no evidence to say that it has specifically to do with hormone levels. That's just a theory at this point.
Dr. Ross.
So Dr. Floyd and Dr. Pham, have either of you or both of you had any patients to get COVID after they've taken the vaccine?
I have not had anyone, to my knowledge, in my practice or me treating personally to get COVID after they've had the vaccination. Of course, I got vaccinated December and maybe 1st of January, and I have a lot of patients that have been vaccinated since then. But nope, no one has developed COVID after being vaccinated that I'm aware of or have seen. I did have a new case of COVID today, and the person was unvaccinated. And we've seen much less, but COVID is still around. So don't think that because the states and different states in the nation may be taking different stances, CDC is making some other recommendations about being vaccinated and wearing masks. Still taking certain precautions, washing hands, wearing your mask, but you can still get COVID. If you haven't been vaccinated, you are at a much higher risk of developing COVID still. So it's still out there.
I'm fortunate because my patient population, because they tend to be older than 50, on, if not one, multiple immunosuppressant medications, they are already approaching this with a lot of caution. So they were one of the first wearing masks, socially distancing, staying at home, not grocery shopping. So my patients who have received the vaccine, I believe my first one, I remember at the beginning, they were calling me to see how to get the vaccine. And they were very, very aggressive in getting it when it was initially very difficult to obtain through the Department of Health and whatnot. And so the earliest ones who have been vaccinated have been able to convince for the most part, the majority of their family members who are concerned or taking care of them, their caretakers, to vaccinate. And I personally have not seen anyone get the vaccine. Get the vaccine and get infected. And I feel a large part is because they're already ultra cautious. And for the most part as well, their family members are concerned and they're vaccinating themselves to protect their loved ones who are at risk.
Thank you. Dr. Lucas?
So a question that's come through is, first of all, how long should someone wait between their first shot and the second shot? And then what happens if, for whatever reason, somebody can't make it to get that shot at the exact that 3-week, 4-week mark? What happens? What should they do?
So for Pfizer, you get a shot on day 1 and then 21 days later. For Moderna, it is day 1 and 28 days later. And if you miss that date, it's better to get the shot later than early. And so you have up to 45 days to get that second shot. And then, there's nothing that says you have to start over yet. And we're waiting for information to come out and say, up to how long can you do that second shot? But right now, you can get it up to 45 days after the first. And even if you're 3 months after the first, I would go ahead and get your second and just wait for more data to come in to know if that's still protective. I mean, one of the reasons why the mRNA vaccines need 2 is because those vaccines, why they haven't been on the market a lot before now, is they're not as protective in a single shot. It takes a booster for them to work. And so that's why we haven't used a lot of them before, but we don't know for sure, since it's the first time we're giving these vaccines on a large scale, how long you can go in between those two. But we know at least up to 6 weeks or 45 days.
Dr. Rouse.
So I want to ask this question directly to our Gen Z and Gen Y individuals. And I'd like for each one of you to respond, if you don't mind. What can we do to reach people in your age group to convince them to get the vaccine? Ms. Larson?
So after hearing what Dr. Pham was saying, I think that there's a very large disconnect between response in older and younger generations, especially in the way that older generations, as Dr. Pham said, take this way more seriously with, more of an abundance of caution, whereas people my age only think that, it's a 99% survival rate, won't be any worse than the flu, I'll be okay. But I think that the big trouble with something like this is a lot of younger demographics don't necessarily they don't necessarily have the foresight to understand how serious this is compared to older generations whose situations would be, drastically more dire if they actually, contracted COVID-19. And so I, for one, know that my perspective is very different from my peers, because with, my mother's career, I see the very, very worst compared to the people my age who, maybe they had a cousin or something that, barely felt sick for a few days and was fine. I hear about the severity of COVID-19, and, I think that if there was more of an emphasis on that with the younger generations, and if there was just more of an understanding, instead of viewing coronavirus as an inconvenience, if they, I wish that younger generations had the foresight to understand how this can affect, something much larger than, yourself, as far as the older generations go.
So, Kaylin?
I agree that we should educate people our age about how it can affect older people, like their grandparents, their aunts, their mothers and stuff, because a lot of them just think about themselves and they just want to have a fun time, they want to have a good time, but they don't really care about everyone else. But if we have that herd immunity, it could just be better for everyone. I think that's what we should.
Sebastian? Your age group, what can you do?
I believe a panel such as this one right here. I think this is a great gateway into reaching the younger communities. Because I think the younger panel here, I think they have a great access to the peers in their community. I think they can spread the word as to what we're speaking about today, as well as the people that joined us live. But as everyone was saying, I think a huge incentive for those that do care about the virus our age is the way that it affects the older generation. I think we understand as young people that we are not as susceptible to being harmed negatively, severely by the virus. But if we, really drive home the concept that it's not for us, it's for our community, it's for that older generation. I think that'll be a great incentive to get the vaccine if we know that we're protecting our grandparents and the older people.
Joannis?
Yeah, what Sebastian was saying, education, like something like this, like a panel. I know people my age group, we're on social media a lot on different platforms. So kind of having more information on like the actual facts, stats. Like I mentioned, people are concerned with how fast that vaccine has been, brought to the communities. So I think reaching out and educating the younger people, just like what everybody else was saying, we tend to be a little more like free spirit, like, I'm okay, I'll be fine, it's just the flu, but educating them on how it can affect people with major health issues that are higher risk. So education, reaching like what we're doing now, I guess, doing it more with more communities, different communities. And like, I think it was Dr. Larson or Fam had mentioned that that people are like, how do I say this? Just hesitant. But if we start reaching each community, I think like we will kind of like get rid of the misinformation that's circling around from people just saying, well, I heard this, or on Facebook, people are saying that microchips and what else, but definitely education and I guess reaching out more to communities like this with panels and getting the community involved with the younger crowd.
Thank you. Dr. Lucas?
Yes, I have a question for Dr. Larson. So just how many people have been vaccinated in the US and worldwide? How many people?
I can tell you in the United States, we've had over 150 million people vaccinated. But if you look at vaccine doses, we've given 279 million vaccine doses in the United States so far. And we still only have about 40% of our country, 48% that have gotten one dose. But if you look at the number of vaccines that have been given worldwide, this number astounded me because, it's a ton of vaccine. Certainly, if something was really horrible with the vaccines, we would have had it show up because we've given 1.57 billion vaccines in the world. And that's just I thought it was a typo when I read that number. So that's a lot. And we don't hear of tremendous numbers of side effects with these vaccines. We just don't. So I just thought it was mind boggling that much has been given so far.
Dr. Ross.
So Dr. Jerome, Dr. Pham, and Dr. Coelho, there's a question that came in that says, is it true that particular demographics were susceptible to the virus and its effects? And if so, does a vaccine affect them differently? Dr. Jerome?
I would say yes to the virus affecting different demographics more severely. I know people of color were affected more severely and were seen and spent a lot of time in our intensive care units. People with just because of the disparities in medicine and access to healthcare, we tend to have more comorbidities or more illnesses that make us more susceptible because of our lack of treatment of diabetes, hypertension, and just obesity. So all of those disparities that were kind of potholes, meaning access to care, access to adequate funds to purchase medication became craters during the pandemic because people of color are more likely to be in the service industry. They're more likely to be lower wage earners. So waitresses, if you're working in a hospital, you're kind of EVS. We don't think about them as being frontline, but when that patient leaves the ICU that has COVID, that's the person that's in environmental services that's coming to clean that room. And that's typically a person of color based on just demographics in the United States. So access to care is huge. Access to treatment is even larger. You put the two together, you're more susceptible to what ails us during a pandemic.
Gotcha. Dr. Pham, your perspective?
I think Dr. Jerome hit that nail on the head. I don't have much more to add to that other than what I've noticed with my patient population is people of color tend to rely on each other a lot. They, especially if they have immigrated and their English is a bit spotty, and they rely heavily on their family members. And so the family unit tends to be large and tends to be tight. And so if one person in the family acquires COVID, it tends to spread like wildfire throughout. So when my patients come, they do report, oh, I had COVID and so also had it, and I had it after my grandson, and it's pretty much the whole family unit. In regards to severity, I would say those with comorbidities definitely are worse. In regards to their response to the vaccine, I have not seen a major difference between different ethnicities in my patient population.
Okay, thank you. Dr. Coelho, in the Latino population?
Yeah, so in my community, especially Hispanics, there's a big barrier, which is the language barrier. So I did even saw patients that would wait until the very last minute when they were really, really sick to go to the emergency room or to even contact their doctors because they're just afraid of the language. How are they going to communicate? How are they going to be able to? It's just a fear of not being understood or maybe even being judged because they don't speak English. It's just a general problem that we are facing with our Hispanic community, and it's a reality. With respect to the like adverse effects from the vaccine, if we have seen like there's I don't think there's anything significant. We have been maybe there's some specialists that have seen that the fear of the vaccine causing a type of glomerulonephritis called collapsing FSGS in the African Americans, but it's not really, there's nothing significant. So overall, like Dr. Larson said, it's a pretty safe vaccine.
Thank you. Dr. Lucas?
So if I may, I would piggyback on the disparities, right? So in the middle of a pandemic, you could no longer go to Starbucks. You could no longer go to Wendy's. You could no longer go to restaurants that had free Wi-Fi, right? So when you were ready to take that leap of faith and get a vaccine, you had no way to register. So when you start to look at the disparities and those that became sicker and still become more ill after the vaccine is considered accessible to all, they didn't have or some folks just don't have a way to get access. So if you say, oh, log online, you see people with a phone and you think, oh, they have Wi-Fi. No, they don't. They go into Starbucks and spend $5 for coffee and you see a whole family doing homework. Or you go into Wendy's, they have free Wi-Fi. You wonder why the family's there doing their homework. You think, oh, that's nice. No, they do that every day because their children need Wi-Fi to obtain that virtual education that was suddenly thrust upon us. So again, potholes became craters. And you add that to a pandemic where you can no longer go into the library, that now you have to call ahead or go online to order your books. So you add that to poor access to medical care, poor access to something as simple and something that I take for granted as Wi-Fi. And then the pothole is now the crater, and then it's perpetuated. So vaccine access is real in communities that have disproportionate disparities based on their income and based on what they're able to do every day to survive. And so I think, okay, I had a sore arm, but if I work at the chicken plant or I'm a contractor, I may have to take a day off from work. So that's the sore arm may be the difference between me making my rent and eating dinner or having gas in my car to do those different things. So the pandemic has shed a true light on those things that are valuable. And I think we're all on here tonight because we want you to know that you can contact us through the NAACP and that there is access to some sort of healthcare. And we're all here as volunteers in the community to make sure that you get the vaccine. I will say giving vaccines has become my therapy. I was ready to quit my job that I spent 12 years to get to this point, and I've been an anesthesiologist since 2001. So when people talk about what they feel, I get angry because I know what we live through as a medical community. And the vaccine has become my therapy. Everybody at work, when I started giving vaccines, they were like, oh, the old Tanisha's back, because it was doom and gloom. To see young people, the youngest person I put a breathing tube in was 27 years old. I saw my daughter in that person. And to see patients continue to come back over and over and over again and get limbs chopped off because they now have blood clots, or to see COVID toes. You can Google all these things, all the right things on the internet, and inform yourself. And it needs to become your passion to end the pandemic, because COVID doesn't care about what you feel, doesn't care about your political values. And getting COVID is like playing Russian roulette. You don't know how it is going to affect you at any age. So the message tonight is get the vaccine because COVID is worse.
Thank you very much. Dr. Lucas?
Thank you. So in that regard, to our younger panel, do you guys know anybody who, any of your friends or anybody around your age who actually got COVID? Any of you?
Yeah, so actually one of my suite mates in college had got COVID. So what happens when you get it at school, they test your whole dorm, and then the person who has COVID has to go into a different dorm full of all the people who have the virus, and they have to stay there for 2 weeks until it's gone. And she was feeling a little sick for the first 3 days. She was nauseous, she was vomiting, coughing, and all that. But after that, she was pretty good.
Anyone else? Any of Elise or Sebastian? Do you guys know any young people with it?
I actually do. I had a couple friends that had it, but it was nothing severe. It was just kind of like the taste, and they were fine. But I did also have a group of friends that kind of did feel ill, and some that told me that they have family members that, unfortunately didn't make it. But yeah, it was a mixture of, oh, I'm fine, and it went away, I feel fine, and to being severe with, like, people dying. So it was just kind of in the middle, like, oh my goodness, is it severe? Is it something to worry about? Because I kept getting both, and I'm okay, it's just a cold, and to where people actually dying.
I actually ended up knowing quite a few people who I knew personally who ended up getting coronavirus. I had quite a few teachers get coronavirus, surprisingly more than a lot of students I was aware of. But at the beginning of the year, when everything, I guess, started back up, when schools went back in session, because my school was fully in person, there were a lot of students who would go to parties and get together in an irresponsible way. And I remember the whole big thing is that there would be entire rows of parking spots empty in the student parking lot where everybody's friends had hung out together and then gotten sick. And I know, surprisingly, even students that are in younger grades than me who have gotten the virus and still have not regained their sense of taste. And I think that's a very scary thing to be, 15 or 16 years old and, unsure indefinitely when you'll be able to taste food again. It's really quite frightening. But yes, I have known quite a few people who have gotten the virus.
All right, Dr. Rouse.
So Dr. Grillo, there's several questions that are centered around pregnancy and infertility. The first one is, can I take the vaccine if I'm pregnant? The second one is, should I take the vaccine if I want to become pregnant? And the third is, will the vaccine produce infertility?
Okay, so I'm actually going to take those in the opposite order. So to be honest, I'm really unclear on where the miscommunication came in regarding use of the vaccine as it relates to fertility. As best I can discover, there's maybe two possibilities of where this miscommunication and where this rumor even started from. And before I get into those, let me clear up. There is zero evidence, zero science that supports there is any connection between these vaccines and infertility. Because of the rumors, because of the miscommunication, it actually was looked into. They did the research and found absolutely no basis and no science to support it whatsoever. So again, my ideas in terms of how this miscommunication even got started is perhaps having to do with genetics, because the Moderna and the Pfizer vaccines are RNA, mRNA-based vaccines. Perhaps there is an idea that it can alter someone's genetics, and that is absolutely not true. That is not the way mRNA works. It does not go into the nucleus of your cell where your DNA is. There's no way for these vaccines to alter your DNA in any way, shape, or form. The other thing that I've heard a little bit from is having to do with adjuvants. Dr. Larson very briefly mentioned adjuvants. So there was an idea that an adjuvant that was being made by a manufacturer, GlaxoSmithKline, you don't need to know who they are, that had an effect on hormone levels. And first off, there's no evidence that adjuvant does affect hormone levels. And furthermore, those adjuvants aren't actually in any of the vaccines that we are giving in the United States or in the world. There are no adjuvants in the mRNA vaccines. So again, just to be clear, there is zero basis for the miscommunication regarding any effects on the vaccine when it comes to fertility. So that has been disproven. In regards to the vaccine during pregnancy, so the initial studies regarding these vaccines did not include pregnant women. However, since they've been on the market, there is a registry that has been started to follow pregnant women who have chosen to become vaccinated either just prior to or during their pregnancy. By far and away, the majority of the people who have received the vaccine are healthcare professionals. There are now over 100,000 American women who are a part of that registry. The initial data from that registry was just published about 3 weeks ago now, showed no increased risk of birth defects, no increased risk of miscarriage, no increased risk of pregnancy complications. The vaccine has been shown to be effective in pregnant women and no greater risk of general side effects. We've talked about the sore arm and, maybe some fatigue or low-grade fevers. Those side effects were no more likely to happen in pregnant women than not. So we are now encouraging conversations and strong consideration for vaccination during pregnancy. You don't have to talk with your obstetrician about it. If you have looked at the data, you feel good about it, you've heard the information, and you want to go ahead and get vaccinated while you're pregnant, we fully support that decision.
Thank you.
Thank you very much. Dr. Lucas?
So we're coming up near the end of our session. But I wanted to talk about the masks again. So apparently in Florida, in just a few days, they're going to just be wide open, no longer required to wear masks out in public, no social distancing. So how is this going to affect those of us who are vaccinated and those who are not vaccinated? How do we tell who's been vaccinated, who's not? I mean, what is about to go on with these masks or lack thereof? Dr. Larson.
I tell you personally, I'm still just socializing with people that I know that have been vaccinated. I feel like that's the very safest thing I could do. Now, I'm just going to choose not to be in big group areas, like let's say a concert or a beach situation. If I have to be around a lot of other people, if I have to be around a lot of other people and I don't know their vaccine status, I'm going to mask. I mean, it's just one of those situations. The vaccine is not 100% effective at preventing COVID, and I know that. Its goal, and we all should know, the goal of the vaccine is not necessarily only to prevent COVID, it's to prevent people from getting bad COVID. And so that's even what the flu vaccine does. So it prevents people from dying. And that's what the COVID vaccine's major goal is, preventing people from dying and preventing people from getting COVID and spreading it. So I'm still gonna play it safe because I just feel like I have to. We've come this far. I don't feel like I can stop now. I have to say it's a little bit of a security blanket for me too, but maybe because of working in a hospital and seeing what we see.
Did anyone else want to comment on it? I would say personally too, that I feel, obviously I'm at home right now, but I'm not ready. I'm not ready to take it off in big groups. And I'm just afraid because I think those people that have decided that they're not going to get vaccinated now, they just have a license to walk around without their mask in crowded areas,
Yeah.
pretend as if they have been vaccinated. So I'm pretty concerned about that.
I also
I
personally
agree with
feel a sense of responsibility to sort of set an example that mask wearing it's just not that hard. It's just not that bad. And yes, I'm fully vaccinated. And yes, the CDC now says I don't have to wear my mask. But I'm still going to mask in the general public. Anytime I'm around people who I don't know their vaccine status, it's what I'm most comfortable with. And like I said, as an example to people in my community, I feel that sense of responsibility.
I agree with both of my colleagues. My main concern is that at the beginning, when the pandemic started, and I'm not sure if you guys remember, or maybe you remember, there was so much confusion between if it was recommended to wear a mask or if you shouldn't wear a mask. It was like the back and forth from the CDC makes me a little nervous. So for now, I would mask myself. That's what I'm just the safest.
I agree as well. Vaccinated, I am. I know a lot of people are vaccinated. When I'm around people that I'm vaccinated or around them, I don't always wear my mask because I'm feeling more comfortable with that because they've been vaccinated as well. But in large groups, I would definitely continue to wear a mask. Don't believe the hype. The mask work. I will give you and this is not, there's no scientific study that says this yet. There's no journals that I know have been, or articles that have been published on this, but this is the least number of flu cases I've seen in a flu season. This is largely because of masks, because flu virus is spread the same way that the coronavirus is. Continue to use hand sanitizer and wash your hands. I haven't had a cold all year. I usually have at least one in the fall. I didn't even have a cold. I've washed my hands more than I've ever had in my life. Wash my hands, use hand sanitizer. Now, yes, my hands been quite dry, but it works. And this is science. We already know this. Public health has been telling us to wash our hands all the time before COVID even came to existence. Cover your mouth when you sneeze or cough. That's been around forever. But now that more and more people actually are aware, and our awareness is heightened because there's something so severe and significant, wow, we actually do better in other areas as well. So I wouldn't be afraid to wear a mask regardless. If I fly, I'm vaccinated, I will wear a mask on the plane. I will wear a mask in the airport because there are so many people in these areas. Now, once I get out and get outside and, around people that I know and, less people around, I take my mask off. But don't be afraid or feel bad because you're wearing a mask and somebody else isn't. The decision is yours. Do your best to protect yourself and protect your family and protect your friends, protect your community.
Thank you. Dr. Larson, as we get to our close, do you want to just address why you think the CDC came out with the recent recommendations that they did?
So in the beginning, the CDC said the public did not have to mask. And what the general public may not have realized is that healthcare workers could not get masks. We had massive orders, nothing came in, no shipments in some cases for a month. So it was a protective measure initially for healthcare workers to be able to do our jobs and to save people's lives. When there were more masks available, people making cloth masks, you saw that recommendation change. So, we were flying this plane as we were building it. So recommendations did change. And I know that makes some people uncomfortable, but that's why initially we had to funnel those resources to where we could take care of patients. Because if we lose our medical staff, we would have fallen apart.
Thank you. Dr. Rouse, you want to wrap this up?
Yes, so let me first start by saying thank you to all of the panelists, especially our local doctors who take care of so many of you on a daily basis. And we really appreciate you taking the time out of your busy schedules to partake in this panelist discussion. Thank you very, very much. But thank you especially to our Gen Y and Gen Z representatives. You guys spoke eloquently and I think communicated effectively to your peers why they should be getting the vaccine. And that's what's most important. And with two notes, there's a question regarding providing a vaccine on the West Side. I would let you know that a group of us attempted to do that in the past, but we're not successful at signing up the number of individuals that we wanted. We are revisiting that through the city councilwoman that's there. And so that's underway on the West Side. And the second question, Dr. Larson, somebody said that the numbers may be skewed because a number of people got their vaccines outside of the state of Georgia. And so that number that you've given us may not be truly reflective of the actual number of people vaccinated in the Carroll County area.
And what they did is they actually looked at the GRIT system, the immunization registry, actually tracked it by address, your home address. So when you get a vaccine in Georgia, it's attributed to, let's say if a patient got a vaccine in Alabama, but they're a Georgia resident, what goes in is their residency status. So the numbers are not ever going to be perfect anywhere, but one of the things is it's just clear that Carroll County is less than has been given in Georgia and the United States.
Thank you very much. At this time, guys, we're going to wrap up. We're going to ask the Carroll County NAACP representative to come on and make some closing remarks. And again, thank you all for participating.
Thank you. I appreciate the opportunity.
Thanks, everybody.
Thank you.
Hello, everyone. Thank you so much again, as Dr. Rouse and Dr. Lucas have already said. Thank you so much for agreeing to serve on the panel, our doctors. This is the second time or third or maybe fourth for some of you all who are participating with the COVID-19 conversations. We really appreciate all of the factual information and scientific information that you're giving to our community. Invaluable. Dr. Rouse and Dr. Lucas have already thanked, of course, our Gen Y and Gen Z panelists. We really appreciate too the insight that you continue to give us. And we definitely all want to work together to be able to support each other because we are all in this together. Special thanks to Gila Gonzalez, who's been handling the logistics and some of the tech support tonight. Also, Sonia Barnes, who is handling some of the logistics and technical support tonight. Thank you, Ariel Jones, one of our NAACP members and officers, for monitoring the social media to be able to provide some of the questions for you. Special thanks to West Georgia Cardiology and Associates, of course, Tanner Medical Center, the Rouse Foundation, and then we cannot forget all of you for tuning in this evening and joining us and contributing with your questions, thoughts. Please share. Remember to subscribe to the Carroll County NAACP YouTube channel. So remember, the greatest wealth is health. Remain safe, healthy, and inspired. And before we close out totally, Dr. Rouse and Dr. Lucas, do you have any further remarks? Did you want to give out that number, Dr. Rouse, for people who are interested in registering to be able to sign up to get a COVID vaccination, because they still are definitely available in the community?
So the answer to that is yes. You may call this following number to get your vaccine, to get registered to get your vaccine. The number is 770-214-1728. That's 770-214-1728. That is the number to get registered for the vaccine. We have access to all three vaccines. That's Pfizer, J&J, and Moderna. If you're interested or you know someone that is interested, please call that number and we'll register you. Thank you. Dr. Lucas?
All I want to say is how we started this out, that we've come a long way, but we still have a long way to go. And let's not take our foot off the gas right now. Let's keep going. Let's do this. We can do this. Thanks, everybody.
Thank you and good night.
Good night.